Brennan Straka is an Orthodox Christian wife, mother, and nurse midwife living in Northwest Arkansas. She received a Bachelor of Arts degree in history from Carleton College in 2007 and a Master of Science degree in nursing from Vanderbilt University in 2015. She currently works as a certified nurse midwife at the community clinic in Siloam Springs and Rogers, Arkansas. Her clinical interests include low intervention birth, complementary medicine, and menstrual health. In her free time, she enjoys singing in her church choir, gardening, traveling, and spending time with family and friends. Please welcome Brennan to the podcast.
Welcome to the NFP Podcast, where we explore the empowering world of natural family planning. I'm Amy Smith. Join me and my co-host Emily Appeldorn each week. Together, we're here to dive deep into the science, the stories, and the spirituality behind NFP. Every week, we push back against the free love culture and advocate for a culture of responsible love, where intentionality and respect are at the forefront of family planning. Join us as we discuss everything from the practicalities of charting and fertility awareness to the profound impact NFP can have on relationships and communities. Whether you're new to NFP or a seasoned pro, our podcast is your go-to resource for honest conversations, expert insights, and real-life experiences. So grab a friend, settle in, and get ready to be inspired. This is the NFP Podcast.
Hi, everyone. Welcome back to the podcast. Today we have Brennan Straka. She's a midwife in Northwest Arkansas, and she's going to tell us a little bit more about midwifery and her background with that and her story. So welcome to the podcast, Brennan.
Hi, thank you. Thanks for having me.
Thank you. So to begin, I'm wondering if you could start by talking to our listeners, giving us a little bit of your background, your personal story, how you got into midwifery, and kind of what that looks like right now in your day-to-day life.
It was sort of a circuitous route for me. I majored in African history in college and had really no knowledge of what midwifery was, other than when I went to Mali in West Africa. The woman who I lived with, we had a host family, and the mom who I lived with was a midwife. So back of my head somewhere knew that she dealt with pregnant women and gynecology and just some of that stuff. And then fast forward 6 years, I was training to be a yoga instructor in San Francisco. Did some other work and just fell in love with the prenatal part of the yoga training. And it was literally just how to keep pregnant women safe if they end up in your class. It was a woman named Jane Austen. She has some videos, and I just ate it up. I was like, this is the moment I've been waiting for to know what to do with the rest of my life. It was so big. So I became a doula, which is a non-medical labor coach. And it was amazing because in San Francisco, they have a volunteer doula program at the general hospital. So biggest hospital, patients who are very low income, couldn't usually afford a doula. I was able to go and do 24-hour shifts, which worked for my schedule at the time, and be a part of these women's births. And it was just amazing. It was so cool. And then I learned about midwifery there because they have midwives on staff and physicians. And it's just a very ideal model there where like the physicians and the midwives work so closely together. I think that's really awesome and ideal. And so I quickly decided that I wanted to go back to school and become a nurse because I wanted to be a nurse midwife and become a midwife. I went to some home births and I loved that. But at the time I was single, and the training I've just always been sort of, I don't know, prone to like trust academia. And so felt like becoming a nurse midwife was just more manageable for me. I could take out a loan and
So a nurse midwife compared to what would have been another option?
Yeah, exactly. So a certified professional midwife, home birth midwife, some people will call them lay midwives. I think most of them don't like that, but certified professional midwife, which is more of an apprenticeship and a beautiful model. I mean, I know them, and I think that practice is so wonderful. But for whatever reason, I was kind of led to become a nurse midwife, and did some, discernment about that. And strangely enough, like, becoming a midwife has brought me back to God.
Wow, that's
Um,
beautiful.
I just remember these very clear moments of like, how can I possibly be in this work, do this work? I was raised in the Orthodox Church, and then in college kind of fell away, didn't know what I was doing. um, didn't know what I believed in. And then I was like, I have to believe in God. Like, I have to, if I'm going to be present for birth and life and all this stuff. It's like, obviously.
I can
um,
imagine being that up close to life has to be so just astounding in so many different ways to be a part of that process.
Sometimes we'll say it's like the highest highs and the lowest lows. I mean, you just it's so intimate. It's so beautiful. Um, So I went to Vanderbilt, and Vanderbilt has a really great nurse midwifery program. They have a program where you can go from not being a nurse to being a nurse in like 13 months and then get your
Wow.
master's. Yeah. So I did this accelerated nursing program. And then I got my master's in midwifery in nursing. Mhm.
I don't know how many people know this information as far as what it looks like to become a midwife, but I realized before our podcast and before this interview, there's so much I don't know. And I'm guessing I can't be the only one. And I know I hear other women talk about using midwives and that sort of thing. And so I have this connotation. I know what I've sat in on lectures about midwifery and different things like that, but I'm just realizing I just don't know the details on, what that program looks like and that sort of thing. So I think that's so fascinating. I wouldn't have guessed about Vanderbilt. Is that customary for universities to have midwifery programs?
Well, Arkansas is just getting our very first nurse midwifery program. Yeah, it's a big deal.
Amazing. That
hmm
is a big deal.
UAMS started like kind of talking about it a few years ago, and then there was always a problem with funding, like anything. And so finally got funding approved. They have a director. They just had their first like accreditation visit with the National Midwifery group that kind of accredits new programs. And then 2027, I believe. Oh, yeah, I can't remember I think they graduate their first cohort in 2027. So I think starting next year, they're going to be having, and they'll be a direct, so you have to already have been an RN. I called it a direct entry program. Yeah. Mhm.
Wow, that's such great information to know, especially for anybody in our area that might be interested in that. Um,
Absolutely.
So you go to Vanderbilt, you get your, is it a cert? It was your master's, you said. You got your
Mhm.
master's in midwifery. That's amazing.
Mhm. So
And
I'm on the
then,
level of a nurse practitioner. So if you think
okay,
about people who, when you go to the doctor and you see a nurse practitioner for XYZ, and I think midwives, people also don't usually know that we do gynecology. So I can see women throughout their lifespan. I can take care of babies up to 28 days. In most practices, that's not necessary. But if I were in a really rural practice, or we are working where I work now on a mom baby visit. So you can like have your first visit with your baby with the midwife. So yeah.
I love that idea, definitely.
Mhm.
So you go to Vanderbilt, and then how do you get started in this, um,
Well, the
in
other thing that God did through me and through this journey was that I was in San Francisco. Bless my parents for just letting me do that and be so far away for so long. But I was discerning, like, where do I go to school? And I was like kind of a snob. I kind of had become a little bit of like, San Francisco's the only place to do anything. And so I got into UCSF. Second try, it took me 2 rounds to get in because they're very competitive. Um, and then Vanderbilt. And I just had this really hard time deciding, really hard. And I was in a plane and I was reading this book. I can't remember, it's by this preacher named Rob Bell. And it was what we talk about when we talk about God. And there's something he said just about like knowing things and having this inner knowing. And I got off the plane and I was like, I'm going to Vanderbilt. Like, and I had been hemming and hawing and hemming and hawing. Turns out that Vanderbilt, one of the final rotations I could do as my, like, it's almost like your, called integration, but it's almost like your final internship,
Yeah.
where you're doing almost everything just with some guidance and mentorship, was at the birth center in Rogers, where I met Amy. So it was like, that would have never happened in San Francisco. I would have never been placed in Arkansas.
So Vanderbilt had a
Yeah.
program where you could work at the birth center in Arkansas.
Yeah, so clinical sites around the country were available. Most of them were in Tennessee. And then a couple were outside of the state, and one of them was Arkansas. And so early on in the program, we were like looking at lists of places to go. And I was like, you're from Arkansas, and nobody else cared. Nobody else wanted to go to that birth center. So I went, and then very quick succession, even before I did the internship, they were like, you want a job? So they knew it would be contingent on me doing well and liking it, but they were like, oh, somebody who wants to move to Arkansas and wants to do this work. And yeah, so it felt kind of like divine intervention. And the birth center where I met Amy, like, it was so sweet. It was so lovely. And we got to take care of we had the best patients. But unfortunately, because a lot of people don't know about midwives and a lot of insurance companies pretend they don't know about midwives, the birth center couldn't stay afloat. So it was just kind of a series of unfortunate events. Financially, it was really difficult. They tried hard, but I was getting married in 2018. And so I worked there for 2 years, and was just good timing for me to go be a mom and a wife. So I'm newly back at it, like very newly, 6 months ago. I took a long time off, and then this opportunity at the community clinic where I am now showed up. And it was sort of, as you can imagine, being a midwife, being an OBGYN, like, it's long hours, it's, up in the middle of the night. And I just always felt like I didn't want to work more than full time. I just didn't want to kind of run myself into the ground, especially with a young child.
And is midwifery something you can do part-time? Is that even possible? Like with young kids?
Yes and no. I like I said, this opportunity that I have now, I think is very unique because we will be on shifts, so we haven't started doing deliveries yet. We're working on that part of it. But right now I'm working 4 days a week in the clinic, and I love that. Eventually I'll be 2 or 3 days a week, but one of them will be a 24-hour shift. So it's just logistically complicated. And I think for the people who it works for, this is just my personal opinion, you have to have family or a lot of money, like a nanny or something. And we have a little money and a little family, but not a lot of people in the area to just pick up, And I'm thankful. I mean, I'm so thankful that I've been able to be home and just experience that. And but we do have a great babysitter now, and she's like just all in. And yeah, so it's been a journey to come back, but it's been good.
That's awesome. So knowing that you had a background in this profession before having your family, starting your family, how would you say that helped you as you started that part of your life? If you wouldn't mind talking a little bit about your personal story.
Well, yeah, it's complicated. Like so much. And there I feel like over time, I've been able to see how God led me through that. But it definitely felt like, being led through the desert. Like it was not the experience I had planned. So we got married in 2018, got pregnant in 2018. And my son was born in Kentucky. We didn't live in Kentucky. So I was planning a home birth, seeing a home birth midwife. And I had some fear. Like I definitely, I think like all of us, and maybe in retrospect, could have listened to that a little more, but I was trying to have this vision of what I wanted. And I would always tell people before, like, have your first baby at the hospital or at a birth center and then try a home birth. Well, pride. I can do this. Anyway, my son was born in Kentucky. I was on a vacation with my husband and I was 28 weeks pregnant, and I knew, because I'm a midwife, that I started to go into labor. And I think there's a family history. Like my great grandmother was born on a farm in Iowa, very tiny. Nobody really knew why. The same year, I have 2 first cousins, and we all had preterm babies. So it was like, mine was the most preterm, but we don't really know.
Do we know if there can be a genetic component to this?
I think there can be, yeah. And like some things in women's health, it can, skip a few generations. I personally, and this is maybe a whole nother topic, I have a gene mutation, the MTHFR mutation, and didn't know at the time, but that can predispose people to preterm birth. So glory to God. Malcolm was in such a good place. I mean, honestly, there is not a hospital in Northwest Arkansas that's as good as the hospital we ended up in Louisville. He had a music therapist, in the NICU.
Say that part again. He
had a music therapist, like a neonatal music therapist. I mean, it was the Rolls Royce of NICUs. And I do think in retrospect, it was humbling, and it was, he wanted me to experience the depth and the breadth of prenatal care. So we did. We were there for 7 weeks, and then we had a grant, which doesn't usually happen, but a man who we had gotten to know there asked for funds for us to be flight in back to Arkansas. It was just the wildest experience I think I've ever had, of putting my 7-week-old preterm baby in an airplane with me. I got to go. He had 2 pilots, 4 nurses, me, and he was in this baby pod to transport him. And he just sucked on a pacifier the whole time, and he just didn't.
Wow.
Yeah.
So you guys come back to Arkansas.
I think at the time I felt. Mm-hmm. Yeah, we came back to Arkansas. We had our last 5 weeks. He took the full 12 weeks to come out of the hospital and to feed. And thank God we were able to breastfeed, the things that I mean, on the end of it, I had this perfect baby who was so normal. And I went through this very turbulent experience together. I think it bonded us. My mom always says, you guys are just so bonded.
How could it not? I think about things like that. How could it not?
Yeah, but it was hard. It was really hard. And I felt like a failure, as somebody who, and how many times had I, as a midwife, told women who needed an epidural or a C-section, you're not a failure. some things we just don't have control over.
It's different when you're on the other end of something like that, I think. That's your job, but it's also your heart, helping other
Mhm.
women. And when it's, and I'm sure that you have a deep love and desire to help other women, and you believe what you're saying when you say these things to other women. But when it's you, it just feels different. Not in a prideful way, but um, I just think I know what you're saying. I really I know
Mhm.
exactly what you're saying.
Yeah. Yeah. And I think I'm really thankful that I didn't have to jump back into work. Um, that was kind of the plan already, but and there were temptations. There were definitely times where it was like, oh, maybe I need to just double down by the skin of my teeth, like get back into work. And that felt like a lot of grace that I wasn't necessary. Um, because now I'm back in it and I'm kind of with time. Um, Still healing. I still feel like, there are times where I'm like, man, I didn't get that. But I'm also able to sit with moms who have gone through really hard experiences and say, I always make a point, even if I see it in their history. I'm going through their history and, oh, this first baby was this, second baby. Wow, your third baby was born preterm. So that must have been so hard. Or you had a miscarriage. I'm so sorry. Um, so our other experience, we've had two other pregnancies. Um, in 2021. Malcolm was born in 2019. It was also a C-section, which he was breech and just couldn't have controlled for that. But lovely. I mean, I'd never met the doctor who delivered him, like all this stuff. And it was lovely. It was lovely. And I do think there was part of me before that was so like, oh, medical system, like, oh, that had to soften because I mean, one of the nurses in the room with me was pregnant, had a preterm delivery with her last child, was just like just an angel to me. And I'll never forget that. Like she was just able to talk to me in a different way and knew that I was scared and not ready, you know.
And had a
Um
desire for everything to be different, I'm sure.
Yes, yes,
Yeah.
yeah. And they were so respectful of me in the hospital. I told them I was a midwife and they were just so like they took every opportunity to like do things I did want, like breastfeeding. I mean, I was a crazy person about breastfeeding. I was like, I will breastfeed this child. And they didn't ever they didn't
Good.
take that away, It was great. Um, so uh But I would always tell my patients too, and I do think I kind of remember this, like you get more bees with honey. So if at the birth center we had to transfer, which we don't have. So at the birth center we had water birth, which is almost like an epidural. It's so good at pain relief, but we don't have IV pain medication or epidural. And if we had to transfer, I would say like, I know this isn't what you want. And if you come in guns blazing, like defensive, it's going to be worse. It is. Like people at the hospital are doing their job. They want to be respected. You want to be respected. Let's come in here and be sweet. Doesn't have to be happy, Um, so I think that helped quite a bit. But so my second pregnancy, we waited the prescribed 18 months to get pregnant. And got pregnant right away. Um, and then, and I know that, can be triggering for some people probably on this podcast. I did not have that experience later. But I was pregnant during the pandemic, 2021, and at 16 weeks, I started to have a placental abruption. And so it was 2 weeks of just awful. And then we lost our baby at 18 weeks, Sylvia.
I'm so sorry, Brennan. I'm so sorry.
It just sucks. It just was really hard. Yeah, I don't know, you know.
Yeah. And once again, I'm sure you've worked with many women that have unfortunately also dealt with the loss at different stages. And yeah, when you don't, I'm guessing that at a loss at any stage is awful. But I've talked to other women that have had loss later in pregnancy, like you did, and there are a lot of differences with that. And I'm really sorry that you experienced that. And you said your baby's name is Olivia.
Sylvia.
Sylvia, excuse me,
Mhm.
excuse me.
Mhm.
I'm sure you feel her presence all the time, I'm sure.
Mhm. Yeah. Um, yeah, that was really, really hard. And like I said, and like you said, and I think I was thankful for the space to grieve. And there was a time when I was like, I don't want to go back to this. Like I'm not doing baby stuff anymore. um, and again, God was really gracious with, it was like, um, I was able to be home. I was really well supported. There's a group here, and I think we talked about this, called Men, that I found through this, that are just some amazing women. There's another project out of Texas called Hope Mommies, that I found, that they have a yearly retreat, for women who've lost, and that was just so healing. And
Did
I've made
you
some
did you
really
attend? Okay.
I went to that, I think, in 2023, I think. Yeah. Um, and with a good friend who I'd made through all this, my friend Miranda. Um, so people who've experienced miscarriages, I've heard it say it's the club that nobody wants to join.
Sure, I would agree. Yeah.
Yeah, and it sort of, there's like a camaraderie, there's a knowing, like you said, you don't know until you know. And I always think, like, years and years ago, my grandmother lost a baby, like women didn't have avenues,
I think about
right?
that a lot, Brennan. I do. I think about all of the technology that we have now to know about early loss and how many
Mm-hmm.
family members before us and other women, obviously,
Mm-hmm.
didn't even know if they lost a baby.
Mm-hmm.
I just, yeah, there's so many things about loss. It really is, it's so common, unfortunately, but it is something that doesn't get talked about, and it seems, until you get connected to someone else that's experienced it.
Mm-hmm. Mm-hmm.
Yeah.
Yeah. And people say dumb stuff.
I'm of the opinion that when that happens, I think that people just don't know what to say. And so when they say whatever they say, it can come across really dumb.
Yeah, people say really, and and I think back of myself when I was working at the birth center, because we dealt with it, and
Of course.
I would be like, oh, a miscarriage creates fertile ground for the next pregnancy. Like, what? And like, there's some truth in it, but it's like, I
Of
didn't mean to
course.
say that. I
Yes.
didn't mean to
There's
say
so many things. And I have to believe that anyone that says, I'm using air quotes to say dumb stuff, for anyone that might say something that feels a little off, I do believe the intention is,
Yes.
heartfelt and really caring. And they want to say something. They don't know what to say, perhaps. They want to say something that will be helpful, but you just never know,
I always, and maybe this will be helpful for people. There was a book that I read called Naming the Child, that was just such a balm to me. And she talks about that, just how like really less words, more tangible support. And, and it's taught me a lot about suffering, which, as Christians, we're supposed to learn about.
Exactly.
But I think like so many things, you just can't force feed that to people. You can't force feed Christ to people, right? Has to be a lived experience, and the tincture of time. Like it just so much over time becomes clear. And the people who my husband thankfully is among them, like the people who just sit with you and just let you be in it is often the best medicine.
Absolutely. I would agree. I couldn't agree more with all of that. Absolutely. So during this time, you're still able to be at home. You're able to grieve without having to go back to work. And so this brings us to this is 2021 when all of this happens. So, knowing that you've recently got back into this profession, kind of tell us after the loss of Sylvia, what that looked like. It sounds like you were able to do some healing with these, the Hope Mommies. Am I saying that correctly? I want to link
Hope
that in
Mommies.
the show notes. Yeah. And different
Mend
things.
too. Mend is
Yes.
a local ministry. Yeah. Yeah. I stayed active. I didn't mention that, and I mentioned before the midwifery program in Little Rock. So there's a small group of us in Arkansas, period. There's not a ton of nurse midwives. And so it's a close community. Like we know each other pretty well. And we worked on, in 2021, some legislation to have midwives be more independent in the state. So nationally, the standard is that we have a scope of practice. So obviously, I know as a midwife, I can't do a C-section. And I even know that like if there's a mom whose pregnancy becomes more complicated, I'm going to consult with a physician and maybe even hand over care. And we're trained to do that. We're trained in interprofessional communication to be able to do that well. But a lot of times the medical system in the state or the legal system in the state has set up sort of, and I do think a lot of times it's well intentioned, like safeguards, right? And so we were in a model in Arkansas where we could do prenatals and gynecology all day long, but we had to have a collaborating physician for deliveries. And in my mind, that's like the meat and potatoes of what we do. So it felt, somewhat restrictive because if you have to have a physician sign off on your work, you also have to find a physician who's willing to give you a piece of the pie. It's for better or worse in the system, it's money, right? And but when you have a system that's set up where midwives can kind of stand more on their own, probably usually as a practice, because being a solo provider is difficult. Then you still have collaboration. We just need to have collaboration. And I think in a way it fosters more respect from both kinds of providers. So when I don't have to be a burden almost to a physician who has to, review my work and sign off on things, then in many ways they're more likely to want to play.
Absolutely. You don't,
Yeah.
I can imagine the less you need them, the better, I would think. For as far as time commitment and that sort of thing. But
Mm-hmm.
but also the respect between the relationship, like, hey, if I do need you, I'm gonna come to you. Like, I'm not gonna try to, you know, I'm not a huge fan of the term stay in my lane, but you know what I mean. Like, if you have these relationships that are open and honest, I would think that that would help cultivate just an easier
Mm-hmm.
working environment among the physicians.
Right. And as you can imagine, in maternal care, there's liability. And so I think a lot of physicians, and I think this is actually not always true, but they felt like if you're under me, then I'm liable for what you do. So then it becomes this kind of micromanaging, controlling thing. And then you understand why, right? They don't want to be
So
sued for something.
is that the case? If something did go wrong, does it fall onto them, or what does that look like?
From what I've heard, that's not the case. It's whatever care has been provided by the provider. And I will say some people, like, they talk about it in the hospital, like delivering a train wreck. Like, I think sometimes in the midwifery world, there's this ideal of what should happen, and it can become at all costs. And that's not right. Like, we believe in the sanctity of life. Like, I want baby to be healthy, but I also want mom to be healthy and to be able to have more children. And so if we need to go get an epidural so that she can have a vaginal delivery or get a C-section so she doesn't, like, have a hemorrhage, like, it's just, there are reasons for the technologies that exist. Every woman does not need a C-section by any means, but it's life-saving at the same time. So I think there's somewhat of a, like, fear of midwives because um, physicians can see the worst of things that go wrong. And I'm thinking, and home births are so safe when they're managed well. They're so, the right patient, the right environment, the right care. Like, I have a good friend, Phoebe, who runs Eden Birth and Wellness up here. It's just a beautiful practice. And there's lots of other midwives in the area who do really great work, but we can get a bad reputation,
It just takes
um,
one, right?
mm,
It's just like anything. A
mhm,
physician that works with one that something doesn't go right, whatever that might look like. And
mhm,
it just can put a sour taste in your mouth. I mean, we can imagine how that is for us just in different forms of medical practice. If we get
mhm,
a bad experience, we just think, that's not a good doctor for me, or whatever the case may be.
mhm, mhm.
So I can imagine that that's a hard for a physician that has worked with someone that things have not gone well, it would be hard to change their lens behind
Right, right. And I
all of
always think
it.
at the end of the day, like, they went into this work because they value women and babies. And, we all, I think, and I've had to learn that. Like, I had to lower my guard a little bit and be like, let me put myself in their position. Like, very, very, very small percentage of physicians might be, like, out to do harm, but that's not what their oath is. That's not what they want to do. So, um,
Exactly.
it's
So
a hard job. It's hard. So yeah. So we did some legislation in 2021 to give midwives more kind of privileges in the state, and that went well. We have an amazing ally advocate in the legislation who just understands midwifery care, and we were able to put that through. And then, so I stayed active. I stayed active as, like, I was the legislative chair for the Arkansas chapter of the American College of Nurse Midwives. And when this job opportunity that I currently have came up, people talked and were like, hey, Brennan might want to do that. So community clinic has been in the area since the 80s and is just an amazing institution. There's a lot of clinics. I think we have 33 clinics in Northwest Arkansas and Oklahoma and Kansas. And as the name says, we make ourselves accessible and available to people who might not otherwise have access to care. So we take insurance, but we also get pregnant women set up for Medicaid if they are uninsured. And so historically, the maternal care, the prenatal care that's been done there has been done by what are called women's health nurse practitioners, which is similar, but they just don't do delivery. So they take care of women, through their pregnancy, and they could do gynecology, but they decided to bring on nurse midwives because Siloam Springs Regional Hospital closed last fall. So they had two physicians there. One of the physicians moved out of state. The other just said, I can't do this by myself, reasonably. And our long-term plan is to be able to deliver at hospital. But without a physician, without staff, we're not going to do that anytime soon. So we provide prenatal care in Siloam. And then we give women a choice to kind of hang out with us a little bit longer than 28 weeks with the hopes that we'll have privileges. And then at the very end of their pregnancy, they'll go to Willow Creek Hospital. Or what happens most of the time is that they will still do the community clinic model of 28 weeks in our care. We get them through the glucose test, kind of that phase of the pregnancy, and then they transfer to a lot of the OB providers in the area, whoever's kind of closest to them and they want to work with. So I honestly, it was a rough start getting back into work.
Sure.
Still, especially with the summer, I'm like, oh man, I really loved having the summer to myself. And, but it's been awesome. I mean, it's just like, I kind of came into midwifery as a doula in San Francisco General Hospital. I love being able to support women who otherwise wouldn't have good support, and
good care.
Yeah. And, our midwifery model, I think, kind of blends the best of like medical and kind of hippie dippy woo woo.
Yeah.
Herbal, try to be evidence-based, right? So things that have research around them, but yeah.
And that's what I'd like to talk about too. First, I'd
Mhm.
like to ask you, and this kind of goes with my question. So I'd like you to talk about what midwifery is and what it's not. And
Mhm.
one of those questions to add to that is when you're talking about a woman at 28 weeks that either starts care with a OBGYN or, well, either way, they're going to start care with OBGYN at 28 weeks. Is that right? Or go to Willow Creek.
So our hope is that we will have them stay with us and then deliver with us.
Okay.
And privileging at a hospital, it's just a lot. And so right now, the moms who are low risk, like they're still having a healthy pregnancy, are not gestational diabetic, they can stay with us. And then there are hospitalists, so OB doctors at Willow Creek, who do deliveries every day of anybody who shows up. So our women have had prenatal care. They've had the full scope of everything, and then they can get it locally in Siloam. And then when they go into labor, we coach them to go to the hospital. So it's and I honestly, like, as a midwife, there right now are two of us there, and we're both kind of like, I don't want that for them, So most of the time, I coach people like, go get established with a provider. Like, I want you to be with the person who you've met when you're delivering your baby, But for some women, just logistically, they have several kids. They'd rather continue getting their visits in Siloam. And take the chance. And the OBGYNs there, the hospitalists are great. Like, they're really good providers. And I think they'll have, so far the people who've come back, they're like, yeah, I had a great birth. Like, everything went well.
Okay, so
So,
that's my
mhm.
question. In an instance like that, do you follow them to Willow Creek? Is there any part that you play at Willow Creek?
So when we have privileges, we will. That's the
Okay.
plan. The plan is that when we have privileges, moms will stay with us throughout their pregnancy, and then when they go into labor, we'll be on call at the hospital, and so we'll deliver their babies. But the great thing there is that we have these hospitalists 24/7 who, if something becomes more complicated, we can consult with, we can transfer as appropriate. So yes. And that in a midwifery hospital practice, that's how it works is, you know, the moms we care for are low risk. If a mom develops preeclampsia, gestational diabetes, all sorts of things that would kind of escalate her pregnancy, we would transfer earlier. As soon as we know, we're kind of like, oh, I it's nothing personal. You'd be better served by a physician. That's just the truth. And which is wonderful. Like, and I've heard midwives described as the experts in normal, and and it's a blessing for us because we get to sort of keep our scope normal, and then when things are
Right.
abnormal, we know how to identify that. We know how to, like, for example, and this is, I don't think, a HIPAA violation. I have a mom right now. She's older. She pre-existing diabetic, pre-existing hypertensive. That's not my comfort zone. And so I'm working closely with a physician. She's only like 14 weeks pregnant, to get her out, to give her the best care we can in the 2 visits we'll probably have with her. And then say, I know you want to stay in Siloam. I wish you could see a provider in Siloam. But I think that the best place for you is with a physician. And I know that I wouldn't give you good care. It's just not what I'm trained in.
Well, and
But
I
on the
think
flip
that,
side, because of that, huh?
no, go
Go ahead.
ahead. Go ahead.
Well, on the flip side, because of that scope, the limit of my scope, I think makes me more able to dive into with our moms who stay. Let's talk about childbirth education. Let's talk about how you want to manage your pain during labor. And not that physicians don't talk about that. Of course they do. But I can give a little more hands-on, and even in a labor. So, you think about going into the hospital and delivering. A lot of times it's the nurses who are taking care of the mom most of the time. And as a midwife, I'm going to be just a little bit more hands-on because I'm also not doing a C-section, and I'm also not doing, whatever else a physician has to do, which, again, thank God. We need
Right.
everybody. Yeah.
Right. So I lost my train of thought. I had a question for you. Hold
Yeah.
on. Okay. So I can imagine, as coming from a pregnant woman's perspective, that's comforting to hear that if the midwife thinks, you know what, your care is better suited with the physician, the midwife should tell them that. And I would hope that would be received as, oh, I'm so grateful that you mentioned that so that I can get established with them, as opposed to getting into some sort of, situation that no one would prefer and it being more of an emergency situation. So I think that's helpful. I'm just thinking about, if there's women listening that are interested in working with a midwife, but not knowing, what if that doesn't end up being my best option? It sounds like the midwife should recognize and point them in the direction if they see a concern that could lead to a negative
Absolutely.
outcome.
Yeah. Yeah. And I think anyone, who's credentialed and licensed and, stays up to date on their stuff is going to be that kind of provider, somebody who, and there are, like, a home birth patient in the state has to have 2 visits. I think it's their first visit and maybe 28 weeks or maybe 36 weeks. They have to have 2 visits with a certified nurse midwife like me, or a physician to say you're still a good candidate for home birth. You're still eligible for this option, which is a good safety measure. And most of the home birth midwives in the area work closely with someone who does these kind of visits to also protect them and keep them safe. They don't want to get into a situation where a mom has undiagnosed diabetes. So yes, yeah, there's definitely sort of an acknowledgement of my limit and where I don't want to step over that limit.
Yeah.
Mhm.
Okay. So in regards to home birth, and I'm guessing, does that possibility for home birth vary state by state? I'm guessing there's different, rules and
Yeah.
regulations, or is that pretty common across the country that home births are acceptable in all areas?
Mm, no. It's not every state. So the what I've been told is either home birth is illegal, and I honestly don't know. I think there might still be a few states where it's illegal. It's legal or it's illegal, meaning like it's just not very well regulated. I'm pretty sure Missouri is a state where, I could be wrong, it is illegal, where there's just not a lot of oversight. And I'm thankful because in Arkansas we actually have a pretty good regulatory body. There's more home birth midwives in Arkansas than there are nurse midwives. Which, glory to God, and then maybe we'll raise the number of nurse midwives. But home birth midwives can only take on so many patients. They have a smaller, threshold because they have to be at the home, right? It's not centralized. So whereas I could take on maybe, in a practice, we could take on 30 births a month. At a hospital practice, you couldn't possibly do that. At a home birth practice, you'd just be. So for them, it'd be like 5 to 10, depending on how many midwives they have.
So so you've talked about you're a nurse midwife. So now we're referring to home birth midwives. So
Mhm.
for the way you were trained in your education, is a home birth something that you specifically can help with, or because you're a nurse midwife, that puts you more in a clinical setting? Is that the case?
Well, yes and no. In my training, we had a little bit of training on home birth, but I don't consider myself an expert on home birth. And if I were to go into home birth, I would want to do an apprenticeship with a home birth midwife, just like they've done to do their training. And then that's part of my personality is I'm always like, let me just go back to square one. I don't want to pretend to know more than I know here. I've been at several home births. I've never been the primary midwife at a home birth, but I've been with friends, former patients after I left the birth center have asked me to come to their home births, which was just beautiful. And to be able to see families, just continue to grow, like that was really cool. Um, but I wouldn't, and I think just my personality, I like to, I don't really thrive on like uncertainty. So if I was always on call or had like longer periods of being on call, I think that would be hard for me. So I feel thankful that I'm in this track. But yes, there are. So my friend Phoebe, I mentioned, is a CNM, certified nurse midwife, who has this practice that does only home birth. And she has a really thriving Eden Birth and Wellness practice. Um, yeah, yeah.
So for
So.
women, okay, so she's a certified nurse midwife as well.
Mhm, mhm,
She just
mhm,
specializes in home birth. So that would have been
mhm.
like an apprentice kind of like
No,
she
for
would.
her, she was a labor and delivery nurse for a long time, here and overseas, and then she got her nurse midwifery degree. We met because she kept knocking on our door at the birth center. Hey, can I work here? Can I work here? But unfortunately, it closed before she was ready to start working. And then she worked at a birth center in Tulsa, commuted from Northwest Arkansas to Tulsa for several years. And then after we passed this law, I think she was already working on it, but it enabled her to do more after we passed this law. And she started this practice that has just thrived, and it's just her heart. Like, she just loves home birth and wants to be able to provide that, and has worked really closely with the physicians in the area to have good transfer protocols. And yeah, so
Okay. I
that's just
guess,
what she's done.
okay.
So
I
we, as
guess
nurse midwives, we have a little more like breadth
a
that we can
range.
do.
Yeah. Okay.
But just like I was saying before, so like home birth, I mean, I don't think this varies across the board. If you have a home birth, you will get more hands-on. You'll have, an hour-long prenatal visit. You'll be able to probably text or phone call your provider, which is amazing, and you probably will have to pay out of pocket. You have to prepare your home. And if you transfer, then you still will have those. So nothing's, you know, it's so individualized. And I think that's what drew me in part to midwifery, is like every woman is so different. Every pregnancy is so different. And I want to be able to give women care kind of in my scope that acknowledges that, that doesn't just cookie cutter, oh, you're, a number and a pregnancy number 52 that I've seen today or whatever.
Right.
Yeah.
I've talked to different women, maybe they've had multiple children, multiple pregnancies, and they're interested in a home birth. They're interested in working with the midwife. They don't know what that looks like. I would guess word of mouth is so powerful in your
Mhm.
profession. And
Mhm.
so I am familiar with Phoebe that you reference. I'm just familiar enough that I know her name. And so I haven't met her or anything. And so once again, anytime I might say, I've heard of this, but I don't have any personal experience with that. And so what would you say to a mom that's thinking about, you know what, I've done this, I've delivered in the hospital, everything's been fine, I have healthy babies, but I'm pregnant again and I'm interested in this. Is there anything that you might say to ease
Mhm.
their mind or to comfort them or to encourage them that, you know what, you could do this and it might be something that you should consider?
Yeah. Um, I mean, I think birth, it's funny, I guess for me now to say this as somebody who's had pregnancies that have not gone like physiologically normal, but I still believe that, birth is a normal physiologic process. And I know this sounds kind of gross, but just like some people really struggle with constipation, and like really struggle with constipation, like, or diarrhea all the time. But like pooping is a normal physiologic process, right? And it's not totally different. um, so just because, so I do think like, I kind of think of our bodies as like innocent until proven guilty. And I don't know if that's the right terminology, but um, if you've had an unmedicated birth, or even an epiduralized birth that you feel like, oh, I could have done that without the epidural, like, um home is lovely. I mean, it's such a lovely place. And unfortunately, the statistics in the country are skewed when they say that it's not safe, because they include like unplanned births that happen at home, right? Women who didn't know what they were in labor, or who and unfortunately there is this like free birth movement. I am not a believer in that. Sorry. um because even if it's your fifth, sixth baby, like, it's so helpful to have a trained professional there. um I think necessary. If you look, so in in the Orthodox Church, we have icons. In the icon of the Nativity of Christ at Christmas, there's a midwife in the icon. Yes,
I
I
didn't
have
know
it.
that.
Yes, yes. I can pull it up on my phone. There's a woman helping, and you think about like, and we don't think of Christ in the manger like it's Christ in a cave more. Um, but let me see.
You'll definitely have
Um,
to send that to me because I think maybe we could use that for
that
the.
would be, yeah, the little clip. Absolutely.
Yes.
So here, I'll show you on my phone.
Yes.
This down here is like a woman tending to the Virgin Mary, and
That's beautiful.
yeah, it's as I came back into my faith that I was raised in, I was like, it was there all along. Like I didn't know what this was, and then here we are. Yeah, amazing, right? You would imagine maybe word spread through the village. There's this woman in labor. She's on her own. She came from another city. Like, so somebody came to help her. Like, glory to
That's
God.
amazing.
Um,
I
but
often
go ahead.
I often think about our Blessed Mother going to Elizabeth, and anytime I
Mm,
describe the visitation and that time frame with my daughter, for example, I always talk about how much she must have cooked for her and cleaned for her and helped her with all of the parts with John the Baptist, the remainder of her
mm,
pregnancy, the delivery,
mm,
that postpartum time, doting on her, getting her what she needed. I
mm,
just think about she really is like the ultimate um midwife, I mean, she
mm,
really, even before, I mean, just at the beginning of her pregnancy, right? Like
mm.
Christ is
And here
conceived.
she is, like
Yeah,
bearing God in her
yes.
womb,
And
and
she's
she's
over
serving.
here,
Yeah.
she's serving her cousin.
Mm.
I just think
That's beautiful.
there's just so many
Mm,
things about midwifery that we really can connect to our faith. And
mhm,
um
mhm,
I think it's such a beautiful component to pregnancy and delivery. I would love to hear about this postpartum time because you talk about um, an ideal situation where mom brings baby and they have an appointment together and that kind of thing.
mm,
What does postpartum look like working with a midwife? Because I think most women that have experienced traditional medicine, it's, for what it is in traditional medicine, it's very limited, and especially not for the baby. The mom is the patient of the
mm,
doctor that they worked with, not the baby. And
mhm.
so I'd be curious to hear how the mother and the child are treated with the midwife in postpartum.
Yeah. Um, well, at the birth center, we had a home visit. So we would deliver at the birth center. Women would deliver with us in our like 4 rooms. Um, but we would do a 48-hour, one of our nurses usually would go to the patient's home for 48 hours and check up on mom, check up on baby. We would check baby's bilirubin levels, look for jaundice, make sure that feeding was going well. I mean, I think that's the biggest thing. And because of so backing up at the birth center, we kept our patients there for 4 to 6 hours after delivery, and then they would go home. 2 in the morning sometimes they would go home and be able to be with their family, which was so lovely because we had had an unmedicated vaginal delivery. Like we could only do that because we had a very low risk healthy birth. Um, and if anything was concerning in that period, we would obviously escalate. But we would see our mamas postpartum at 48 hours. And then we usually did like a 4 week visit instead of a 6 week visit, but sometimes we wait until 6 weeks. And we usually do a couple of phone calls in between then to check up on them, make sure they had everything they needed, and they knew that if they needed to come in for concerns. So I love that part of it. Right. And having been postpartum myself, I'm like, wow, like it's just so valuable. It's so valuable. You don't really know what it's going to be like. And if you're blessed to have family who can support you, great. But even that can be complicated sometimes. Family who wants to be there and it's not really helpful, or you're entertaining. Like then you're the one kind of like hosting. That's awkward. Um, so we would, even in our prenatals, we would go over like, how can you help your family help you? Whether it's having a running list of tasks they can do. Like if you come see the baby, you can also start a little laundry, or you can also do some dishes for me, or make sure you bring a meal. At our church, our kind of postpartum ministry is just a meal train, and it feels think really helpful to most women to have every few days a meal and a visitor, but also not every day. We're very, very intentional. Like, you don't need people at your house every day. And if you're not the kind of person, or it's not the kind of time of year or whatever, you don't want people to be in your house, you can like set it up so it's outside. So it really serves the women. And I think that, I think as a midwife, that's my hope, is that I don't want to burden a postpartum mom. I don't want to. And so when we're setting up these visits, our desire is that we're taking a burden off of her to have to drive to the pediatrician and drive to her provider. She can come and see us and check 2 boxes off at one time.
I mean, as I'm hearing you describe, these different stages of pregnancy, delivery, postpartum, for someone that is a good candidate for this, as low risk, if the midwife feels like we should continue working together, continue care, it feels very comprehensive and
Mhm.
and just so helpful, especially for new moms, that you're speaking about things that until you've done it, you don't know that you don't want a meal every day. You don't know that
Mhm.
you don't want people coming over. Or maybe you do, whatever the case may be,
Mhm.
but just to have those conversations, I think so much of that is an afterthought in just generally
Mhm.
speaking. And so I could imagine that that would be really helpful to moms to be thinking about all of those aspects ahead of time, and just to have the
Mhm.
tools and the conversation pieces that they need in order to set the boundaries that might be needed. So,
Mhm.
um,
I always thought of myself as the bouncer, and I think at a home birth it's similar. Like at the birth center, we would have these families come, and like 15 parents, like 15 families and their kids and whatever. And we would welcome it if that's what she wanted. But sometimes I would say, everybody out, everybody out. And we talk about in birth, like a labor dystocia. So like labor started, but then it kind of stops for some unknown reason. And sometimes that's when we get Pitocin, right? But I was trained, like, look at the environment. Is this a place where physiologically a mom would feel safe? Is this a place where she feels, comfortable, supported, and back to pooping? I'm just like, I remember a midwife instructor telling me, like, we turn the bright lights on. We've got like 14 people in the room during a delivery. We've got beeping noises and the TV's on sometimes. I'm always like, turn off that TV. Like, even if it's a distraction for her, like, turn it off. If she needs to be in her body, this is a huge process, like, don't miss it, and a lot of times I would find at the birth center, like, the moms, maybe they thought they wanted their father-in-law in the in the room. But if we got him out of there, things would start percolating again. Or I just had some women who thought, "Oh, I want my kids in there." Like, and with a home birth can be tricky, but I think at the same time, they're home. They can go to the room, like we can have an aunt there or something. But um
I'm sure you've seen a lot of
yeah.
scenarios where you've had to definitely read the
Yeah.
room and figure out what might work better. So,
Yeah. But that doesn't end postpartum, like you're still breastfeeding, you're figuring that out. And like, do you want your schedule to be around the visitors that you have? Or can you do just a little pre-planning and say, hey, or just learn how to say no. And I think that's a good lesson as a mom, to say, I didn't sleep well last night. Um, baby's fussy. Like, it wouldn't be helpful for you to come right now. So let's reschedule.
absolutely.
And how many people, if they're upset, okay.
That's something that's on them, because if
Yeah, yeah.
they should, most women would understand exactly what that meant. So,
Right, right.
um, this has been so beautiful. I really appreciate you sharing everything that you have. And is there anything that we didn't talk about that you would really want people to know, or yeah, feel free if there's anything you'd like to add before we wrap up.
Well, one thing that I often get, and even from like good friends of mine, is just that they don't know that midwives provide gynecology care, and that's actually one of the reasons we connected, talking about the Creighton method, and and it wasn't why I came into midwifery, but I found more and more that um, I love being able to offer people some alternatives to birth control, some alternatives to, um, I, I don't know, just problems that they come up with in their women's health, and to provide like pap smears and breast exams. And and we have a program in Arkansas called Breast Care where like women are eligible for that, even if they have no insurance. Um, they get a pap smear, they get when they need them, they get mammograms if they need them, like just preventative medicine. And I don't know, more and more that's like an interest of mine. And I want people to know that you can see a physician. We're going to give really similar care, but we might also have a little more holistic approach. Um, and I know like Phoebe does some, I don't know how much she does anymore, but she does some gynecology as well. So yeah,
Well,
infertility,
and
the
I know
whole
the answer
gamut.
to this, but I'm just thinking about when you say describe it like that, I think some women might also think about their daughters and perhaps wanting to talk through,
Mm,
what they might be going through, but not feeling comfortable to take them somewhere where they're afraid they may just be given a pill to
mm.
take to mask whatever's going on. So, is that something that you could also help with young girls and kind of help get to the root cause of maybe some
Mhm.
issues they might be experiencing?
Yeah, yeah, absolutely. I'm sure you guys have talked about like PCOS is a huge epidemic and related things, not quite PCOS, but some abnormal bleeding and things like that. Yeah, absolutely. I think, and I love working with young women. We have some young moms and some young patients who come in for period concerns, and I just feel like they're so impressionable and like eager to learn, and they're learning about their bodies. Like, how cool.
It's so
Yeah.
empowering, isn't it, to see young
Mhm.
women
Mhm.
especially, but and women of all ages, to learn a little bit more about
Mhm.
their bodies, I think. Okay, if someone locally
Mhm.
would love to see you, can you tell them how they could get in touch with you? And then
Yeah.
otherwise, maybe we could link to, I'm guessing maybe there's like a overview site where if people are listening outside of our area and they're interested in finding a midwife, is there somewhere they can go?
Mhm.
And we can link all of this in the notes.
Yeah. Yeah, absolutely. So I work at community clinic, and I'm 2 days a week in Rogers, 2 days a week in Siloam Springs. Um, there's another midwife there with me named Candace Killian, and we flip flop. So she's in Rogers on Fridays, Thursday and Friday, and she's in Salem on Monday, Tuesday, Wednesday. And she's lovely. She worked with Phoebe at the home birth practice. And like I said, we're not doing deliveries yet. Um, in Rogers, we don't see pregnant patients who aren't on Medicaid, but if you're uninsured, then we can help you get enrolled and figure that out. In Siloam, we see patients with insurance or Medicaid. And then, but we can do gynecology in Rogers for patients who are insured. Um, and then there's an ACNM, American College of Nurse Midwives, has a Find a Midwife, but also um, NARM, North American Registry of Midwives, I think is the best place to find. They have a website. There might even be like midwife.org. But yeah, there are places online, search for a midwife, that have a list of registered um, professional midwives. So,
Awesome. Thank you
mhm,
so much, Brennan. Once again,
absolutely.
I really
Yeah.
appreciate this. I know Amy does too. And we look forward to getting this information to other women and moms because I think
Yeah.
it just expands the knowledge to just what care can look like during pregnancy and after. So thank you. Thank you.
Yeah. And thank you all for doing this and for doing what you're doing. So beautiful.
Of course. Yeah. So until next time, we'll see you guys on the next podcast. And thanks again, Brennan.
That wraps up another episode of the NFP Podcast. Thank you so much for joining us today. We hope you found our discussion enlightening and empowering. Don't forget to subscribe so you never miss an episode. We'd love to hear from you. Please connect with us by sending us an email with your questions and stories to thenfpshow@gmail.com. We'll be back next week with more insights, tips, and heartfelt conversations about natural family planning. Until then, love responsibly.